Okay, it is noon, so we'll get started. We have a lot of information to cover today. And in case you're wondering if you're in the right session, today we're talking about our Medicaid waivers, our home and community-based services waivers, and otherwise known as DSPD waivers. Some people recognize it by that name. My name is Jenny Dopp, and I am with the Utah Parent Center. So I wear a couple of different hats there. I'm the development director, but I also work with Transition University and also with HCBS waivers. So I know just enough about everything to be a little bit dangerous. So hopefully we can pull all of this information together for you and make it into something that is more bite-sized, and you can really drill down and try to understand your waivers more and help let your waivers work for you. So this is my contact information. If you have questions and you want to reach out after, I would be happy to work with you. And we also have other staff who work with waivers as well. So a lot of people at the Parent Center can help you. Before we get started, I wanted to introduce you to something or maybe remind you of, in case you already know about it, but the Family to Family Network is one of the projects of the Utah Parent Center. And the Family to Family Network is a statewide network that educates and strengthens and support families of people with disabilities. And my family has taken advantage of the Family to Family Network. So I have a son, Jackson. He's 23 years old. If you were on our class yesterday about advocacy and self-advocacy, I introduced you to him a little bit more. But we have been sitting on the DSPD waitlist for about a decade. He's now 23 years old, and that might shock some of you and think, gosh, there's no chance I'm ever going to get off. Why should I even apply for services? And we're going to talk about this a little bit more in the presentation, but there's two main reasons why you need to be on the DSPD waiting list. One is because you will potentially qualify for support funding while you're on the waiting list. Jackson's qualified for that twice. So we would not have received that funding if we didn't have him on the wait list. So that's one reason, is you can access services. The second reason why you need to be on the DSPD waiting list is it tells the stakeholders in the state, so all of our disability organizations, as well as the legislature and the governor, how many people there are in the state that need these services. So it's really important. Right now, this is being discussed, and we'll talk about this again more later in the presentation about bills that are coming on the floor in both the House and the Senate that determines this funding. And so if we don't get on the wait list and show the need, it doesn't translate well. So we need to show that there is the need so that funding can be appropriated. But all of us who are sitting on this wait list, it's not hopeless. There are this network of support. So you'll see all of these active networks in the state, around the state. And we still need leaders for the network in Davis, Cache, Washington, and Iron. And so they have activities like Easter egg hunts, family parties, movie nights, potluck. So there's this fun opportunity for families to get together, but at those meetings, there's also information and resources that are shared. So it kind of serves a dual purpose, and the effort is put in so that these families who are sitting on the wait list like mine can receive that support, that community. You're not alone. We'll walk with you through these hard things that you're going through. You know, I have a big family, but my siblings don't understand what it's like to parent a child with a disability. But I promise you, every person who attends these meetings understands what it's like to navigate life in your shoes. And so we would really encourage you to connect with our Family to Family Network. Mindy Rivera is our Family to Family Network leader, and I will have Sarah, who's on part of the Utah Parent Center. She's helping with the chat today and answering your questions. She'll put Mindy's email address in the chat so that you can reach out to Mindy if you want to get connected with one of those active networks, or if you would like to be a leader in one of those counties. And it's not overwhelming. She'll walk you through it. She'll make sure that you understand what your role and responsibility would be. And if you're interested in getting involved and helping with advocacy work, this is a great opportunity. Okay, so let's get started. So some of this is going to be repeat for some of you because you're maybe already in services, maybe you're a pro, you've been doing this for years, but I promise you, you'll still get something out of this today because we'll cover some new information, and we'll also remind you of some things that maybe you've forgotten about that can help to make your experience with waivers even better. So when you come off of that DSPD waiting list, right, you finally get that phone call and you finally get allowed to play in this pool of waiver services. And there's a lot of information. And sometimes families feel overwhelmed and confused because this is like all new language. So they'll tell you you need a support coordinator. And sometimes it's called an SCE, support coordinator external. So sometimes you'll hear it referred to as a support coordinator or an SCE. And you want to understand what their role is because really they're your best friend through this whole process. You'll want to find out who a provider is. How many providers will you have? What happens if you want to change your providers? How do I find new providers? What does the term PCSP mean, or person-centered support plan? And why is it important? What is this new thing called the Settings Rule? Sure, it was established in 2014, but what does it mean now that it's going into effect? What does the term SaaS mean? So there's all of these different terms that can be really confusing and overwhelming. And I know it sounds like we're going to go over a lot of information, but I'm really going to break it down for you in a bite-sized chunk. So really stay with me. We'll answer as many questions as possible. And in addition to the DSPD waiting list, there's also a coordinator that you should have been assigned. So I just recently updated Jackson's profile and told them all the things. This is not the time you want to be the hero. This is where I really express what it's like every single day to navigate this world of disabilities with Jackson. And so I make sure and I really keep that profile updated with Jackson each year. And then when I get this call from my transition coordinator, they'll help walk me through this process as well. Okay, and you can always reach out to the UPC. Call us whenever you have a question because we have people dedicated to answering your questions and really helping you. The other tool that we have for you today, maybe you've already heard about this. I've talked about it a couple of times in different meetings around the state, but this is a brand new guidebook. So all of this information has never been pulled together before in one place that really gives a neutral viewpoint of what DSPD is, what a support coordinator is, how to handle your budget. All of these tools have been pulled together in this one resource book. And there's a link, Sarah will put a link to the chat, a link in the chat, excuse me, to the book. And you can kind of peruse it. It's also available on our website. When you go to our resources page on the Utah Parent Center website and you click on DSPD, the booklet is there. And it's also on our handbook page under our publications tab. So you can find it in a couple of different places. Right now, it's a little bit out of date. It was just created in May, but the reason why it's out of date is because we are waiting to have them make decisions about caregiver compensation. And so once all of that information is finalized, we understand the tiers, we understand how everything is going to work, I'll update the book again and we will relaunch it to you on the website and through email so that you can get the most updated version. But right now it's pretty close. It's just the caregiver compensation piece that we really need to have defined. But there's QR codes in there. You'll also notice these little symbols on the table of contents. We really tried to organize it so that if you needed to find out about money, just go right to that money tab. You can flip through it if you print out a copy and see where the money symbol is, and then it will take you right to that whole section. So we've tried to make it as digestible as possible for you. So it's important to understand how the disability community arrived where we are today. Like, how did we even get waivers? Why are they a thing? Um, how how are decisions made about how the waivers are used? It's really important to understand the past and where we've been so that you can not only understand where we need to still go in the future as far as our advocacy work and advocating for rights and access to services in the future, but so you can use them appropriately. Advocacy requires knowledge and practice and patience, right? It's just over and over learning more, meeting with legislators, understanding the fiscal process, because it's really easy for us to say, oh my gosh, there's all these people that need help. Why can't they help us? But it's when you understand the process and how we've arrived at this point, it makes you more informed and you're able to speak to these problems or articulate these problems and possibly come up with solutions. Because when we talk with our legislators, right, we want them to fix the problem, but also can we work together with them to help fix the problem and come up with ideas? And we can do that when we understand the system. So there have been multiple laws across the years that have impacted people with disabilities. And so I've listed here for you some of the laws that have been created. And um, over time, these have evolved and changed. So it started with the Katie Beckett waiver. And I'm in the process of creating a whole video for you on the history of advocacy work and how these laws have dovetailed on each other and built the programs that we have right now. But because of decisions like the Olmstead decision and the Katie Beckett waiver, it's made it possible to waive institutional care. I've heard stories of people, having a baby born and the baby has Down syndrome, and they were just encouraged to put babies in institutions. And so because of Katie Beckett waiver and the Olmstead decision and the way that our society has evolved, we now have the tools and the resources to care for our loved ones at home. And I can care for Jackson here and provide the resources that he needs, along with the community resources that are available. But because of these milestones, the institutions are no longer the standard, which is a wonderful thing. We went into a lot of detail on this yesterday. If this interests you, contact the Utah Parent Center. We can connect you with Transition University resources, our entire purple section of Transition University, and we'll give you the links to this later in the presentation. But it goes through in depth all of the different bills and the history of them and what they mean. Because I know when I first started in the disability world, that last one, WIOA, I didn't even understand what that was. So it is really great to get familiar with it and to understand the process better. Okay, so one of the recent changes that was made to the HCBS project is the implementation of the settings rule. And you might have heard a little bit about this if you're in services and you have a support coordinator, maybe they've mentioned this to you, but it was actually established in 2014, and it was meant to prioritize individual choice and allow full access to the community. And it offers greater control to Jackson so that he can live where he wants with the people that he wants, how he earns his money, how he spends his time. Because even if I have guardianship of Jackson, Jackson still needs choices in his life, right? He still needs that self-determination. He needs to be able to have the ability to speak for himself. And as a guardian, I can help guide him and direct him and protect him. But as much as possible, I want Jackson to self-determine his life and determine what his life looks like. So let's get into the settings rule. We've created this video for you, and it goes through these 12 steps, and it's pretty quick. I think it's about 3 to 5 minutes. And because the settings rule is kind of confusing, we think this will help break it down for you to help you understand. Let me know how the sound is. Federal guidelines and laws ensure people with disabilities have equal access to services and opportunities. These guidelines are designed to ensure people with disabilities are not discriminated against and are provided with reasonable accommodations and services. The settings rule was established in 2014 and is a vital part of the broader effort to promote community integration for people with disabilities. The settings rule prioritizes individual choice and full access to the community. The settings rule offers individuals greater control over where they live, with whom, how they earn money, and how they spend their time, including controlling their own schedule. People with disabilities have the same right as anyone else to make choices and to access the broader community. In keeping with this rule, providers, organizations, and programs who offer home and community-based services, or HCBS, must meet the following 12 requirements. Number 1, the setting or where HCBS services are provided is integrated in and supports full access of the people receiving HCBS in the greater community, including opportunities to seek employment and work in competitive integrated settings, engage in community life, control personal resources, and receive services in the community to the same degree of access as individuals not receiving Medicaid HCBS. Number 2, the setting is selected by the person from among setting options, including non-disability specific settings and an option for a private unit in a residential setting. The setting options are identified and documented in the person-centered support plan and are based on the person's needs and preferences. For residential settings, resources are available for room and board. Number 3, the setting ensures a person's rights of privacy, dignity, respect, and freedom from coercion and restraint. Number 4, the setting optimizes but does not regiment a person's initiative, autonomy, and independence in making life choices, including but not limited to daily activity, physical environment, and with whom to interact. Number 5, the setting facilitates individual choice regarding services and supports and who provides them. Number 6, the person has a lease or other legally enforceable agreement. The agreement should have protections equivalent to those provided under state landlord-tenant law. Such agreements protect a person from being threatened with discharge by their provider. Number 7, the setting ensures the person has privacy in their sleeping or living unit, including lockable doors, choice of roommates, and freedom to furnish or decorate the unit. Number 8, the setting ensures the person has the freedom and support to control their schedule and activities and have access to food at any time. Number 9, the person can have visitors of their choosing at any time. Number 10, the setting is physically accessible to the person. Number 11, the setting ensures that any modification of the HCBS settings, qualities, and conditions is supported by a specific assessed need and justified in the person-centered support plan. Number 12, the setting enforces the home and community-based settings regulation requirements. The settings rule is in place to ensure you have choices in the services you receive and to make sure you can participate in the community in whatever ways you choose. The settings rule guidelines apply to any setting where you receive HCBS services. This includes, but is not limited to, the setting in your home, a residential setting, in the community, or even a day program. The guidelines also apply to employment supports, regardless of whether they are provided in a facility, through supported employment, or through some other related services provider. If you have a question or you are concerned about a setting not being compliant with a settings rule requirement, there are resources to support you. Reach out to Utah's state Medicaid agency through the Department of Health and Human Services. The service system is here to serve you on your own terms. By following these guidelines, businesses, organizations, and individuals can ensure that people with disabilities have equal access to services and opportunities. Okay, so Sarah's added the link to that video in the chat. I know it was a lot of information, and the booklet will go through and do a deep dive on the settings rule with you. So in the guidebook, we take several pages and just say, okay, what about this scenario? How does the settings rule apply to this? Because it's been a little bit, intense to roll this out to providers and to families and make sure that everybody understands it. But really, the idea behind the settings rule is so that when Jackson's out in the community or when he finally gets on the waiver, he can have access to the places he wants to go. If he were to live in a group home, he would be allowed to have that lock on his door. He could choose his roommate. He could eat food when he wants, not just when a provider wants to feed him. So it's really important to understand the settings rule so that you can use it as a tool for advocacy for yourself if you're a self-advocate, or if you're a caregiver and advocating for your loved one. Because it's kind of like, I think back to when Jackson had his first IEP, right? I was so excited for services that I just wanted the school to tell me all the things. And I didn't understand that I had, there was a procedural safeguard in place, that there were tools that we could use, that I could say yes or no to things as his caregiver. And the settings rule is kind of like that. It's this guideline that everybody has to play by the same rules, and it allows our loved ones to have access and inclusion in the community. They're not just restricted to a certain type of life that might not be what they want for themselves. So go through the guidebook, see if it answers your questions for you. And if not, please reach out to us. Please reach out to DSPD. We would love to help you understand this more. In the guidebook, we also go through and outline all of the different types of waivers available. The CSW waiver, the Community Supports Waiver, is one of the most common waivers, but there's a few other waivers available for families depending upon the needs of their loved one. And so we go through the guidebook and we explain how the settings rule applies to each and every waiver that's available. Okay, so let's start at the beginning, right? You get that phone call, congratulations, you're off the wait list. And sometimes parents feel like they have just made it. And now all of their challenges will, and their hard parts will be gone from their life. But really, DSPD is a tool. These waivers are a tool to help support and to provide services. It's just like with Jackson's extra chromosome, right? I can't extract DNA and remove the challenges that his extra chromosome provides in his life. And DSPD can't totally negate all of the challenges that are going on in your life. But what the Utah Parent Center can do, what DSPD can do, what waivers can do is help provide the support and the resources to try to just soften and support and help you lift and help to provide the best life possible for your loved one. So you're finally off the waiting list. You get this call from the DSPD transition coordinator, and I'm going to take you through this scenario. This is Ben's story. Ben is off to the right there. And Lisa is Ben's temporary DSPD transition coordinator. And she notified Ben, or Ben's caregiver, depending upon the situation, that in 2 months, Ben is going to be coming off the wait list, and everyone's just celebrating. But in the meantime, Lisa has told Ben and his family that they're going to conduct assessments and create Ben's initial PCSP, or remember that's the Person-Centered Support Plan. And Lisa will also assist Ben in accessing Medicaid since he does not currently have Medicaid. Lisa explains to Ben how she will request services and establish a budget for him based on the assessment that they complete. And it's possible not all services requested will be approved, or they might not be approved at the funding level that has been requested. Okay, so Lisa explains to Ben about the need for that support coordinator, that SCE. If Ben is unable to find his own support coordinator, Lisa can help him. And before Lisa hands off information to the new support coordinator, Lisa will make sure that Ben has at least one provider in place. And if SAS, which is a self-administered service, we'll talk about that in a minute, is selected, Lisa can also assist Ben with that information. So after interviewing several SCEs, Ben decides to select John as his SCE. And John has 30 days to meet with Ben. And John will review the assessments that have been done and the budget given to him by Lisa from DSPD. John will update Ben's PCSP and help Ben find providers if they need help finding providers, and also identify ways for Ben to meet the goals that have been identified in Ben's PCSP. So Ben can either choose a provider model, which is like if I were to take Jackson to like a day program, that's a provider. Or they can use a SAS model, which is a self-administered model, or they can use a combination of both. And a SAS model would be like where I would hire my neighbor to come in and help care for Jackson during certain times of day with respite care. But if you use caregiver compensation, that's also included. That's not a provider, that's more in the SAS model portion. And if Ben chooses the SAS model, then he also needs a fiscal agent. So a fiscal agent is awesome. When I've had that one-time funding, my fiscal agent really helped me with my timesheets and understanding payroll and all of the pieces that go into the fiscal piece or the finance piece. So John will be Ben's guide and help Ben understand his budget, his goals, and his services, and help Ben interview and hire providers if needed. And he will oversee Ben's budget and the billing, and track and document Ben's progress and advocate for Ben. If Ben chooses a provider model, providers send reports to John monthly, and John will review the information for compliance and also report back to DSPD. So this is a really quick model of how the process works because, again, because we're on the wait list, we've never really understood the flow or how this will happen when Jackson finally gets off of the waiting list. And so just as a reminder, if you've chosen a provider model and you're currently in services, you can always shift that. You just really need to work with your support coordinator and they can help you redefine what your plan looks like based upon your needs and based upon what that person-centered support plan looks like. And if you feel like your person-centered support plan is out of date, then update it. It's not one of these things where it can only be updated once a year. You can update that as things change. Let's say your family moves, or my husband was diagnosed with cancer, and so that would have changed what the dynamic in our family looked like. Jackson's sister moved to St. George, so I lost one of his natural supports within my house. So I would want to call my support coordinator and update that. This is kind of a comparison chart for you that shows you the difference between the SaaS model and a provider, and then also, again, that combination model. But work with your support coordinator to decide which option is best for you. And again, caregiver compensation is still being defined right now. We've had a lot of meetings with legislative delegates and with DSPD. I know that parents have shared feedback regarding caregiver compensation. So just know that the Utah Parent Center is really trying to get that information pushed forward and to represent the feelings of families. And we're trying to figure out something that will work for families, but also meet the requirements of Medicaid. So that's coming, and we'll push out this book again to you once that's been finalized. So in between the time you're notified that you're coming off the wait list and when your services begin, your temporary DSPD coordinator will conduct something called a UCANS. And we have a bunch of links that we'll put into the chat. Also on our DSPD website page, we have links to all of these assessments and all of these resources that we talk about today. But your UCANS assessment is usually completed during your intake meeting. And UCANS stands for Utah Comprehensive Assessment of Needs and Strengths. And you can go to that link that Sarah's put in the chat so that you can look at that if you want to on your own time and really see the ins and outs to that. But your responses on the UCANs indicate what is important to you and what services you need. So the service you need will determine your budget. So if Jackson has a ton of behavioral issues, and that is really our main issue, it's really going to be documented in that assessment and within our person-centered support plan. And that's what will determine the budget, is based upon the needs. So your person-centered support plan is really important, and it's based upon that UCANS. So Sarah, if you'll add that to the chat, that would be great. Okay, let's go through a couple of other terms that might be confusing. So when a schedule of services is created for you, like Jackson's behavior services or his respite services or supported living in our house, each service is attached to a service code. And you need to work with your support coordinator to understand which codes are available to you on your waiver and which codes are tied to services like maybe vocational rehabilitation. So discuss your needs with your support coordinator, and services are selected based on your needs and your individual circumstances. So maybe your neighbor down the street, they have services as well. Their plan is going to look different than yours. So just because someone else is getting a certain service code doesn't necessarily mean you will. It's based upon your needs. So you really want to be communicative. And again, this is not where I am the hero and I'm doing all of the things. I need to communicate what I need in my life to help support Jackson, and so that Jackson can live the life that he wants to live and the life and the services that he needs to be successful. But your budget of the year will consist of a certain amount of service hours, and it's allocated into these codes. And all services are billed in increments called units. So a unit could be a multiple of things: a daily unit, a session, a quarter hour, etc. And your budget is based on your needs. So it's important for those things to be allocated to you in the amount that you need them based upon what is determined in the assessments. And these budgets are reviewed every year. And if your funding is not utilized, your budget may be reduced to match your needs. So if you feel like, I remember when we got this one-time funding once, we had all of these respite hours, and I called my coordinator and I just said, you know what, I'm going to have a hard time using this. What Jackson really could benefit from is this summer program at Camp K in Salt Lake. And so she was able to reallocate that funding based upon his need and based upon what would work best for his care. And so work with your support coordinator and just communicate, because something can't change and improve unless you share what's happening. And a support coordinator works with individuals and disabilities and their families to develop those plans and try to meet the needs and wishes of the individual with a disability. And these person-centered support plans are so important. If you have questions about them, there's two places I want to refer you. Not only the guidebook that we've linked before, but when Sarah links the Transition University curriculum, it's the entire green section. It's that community living section. It will link you to services in like charting the life course or community mapping, understanding the difference between what a natural support is versus a provider support. It really helps you understand, even what the grievance process is. And if you have a challenge, what are your options? So I want to show you this list here. This is your support coordinator's responsibilities. So every year, your support coordinator should be holding a person-centered support plan and helping you to develop those goals. And if that's not happening, you need to call them or call DSPD. And if your support coordinator, if it's just not a good fit for you, you can always switch your support coordinator. You're not tied to one person. So make sure it's a good fit. It's like finding a therapist, right? If I don't mesh well with that person the first couple of times, I can always switch. Be sure and make sure the providers and the team members are invited to these meetings. It's like an IEP meeting. You want to have everybody at the table that's contributing to the program, and so that they can have a voice, and it's your meeting. So you get to decide who gets to come. Your support coordinator will oversee the budget, the billing, they will prioritize their needs, and they'll meet with family members. They'll follow up with your Medicaid renewal and ensure that medical services are met. They'll help you find disability resources. They'll approve all of your payments to providers and track and document process and advocate for you. So a support coordinator is not necessarily going to be able to increase your budget. That's not their role of advocating. Their role is to make sure that based upon your assessment, based upon the needs that have been determined, that your schedule of services or the way that your plan looks is really going to address the needs that you have. Now let's talk about providers. In the booklet, we have a whole page that goes through, okay, what's a green flag for a provider? What makes a really awesome provider? Or what's a red flag? What are the things that you should watch out for or be aware of so that you can make sure you're connected with the right person? And DSPD has hundreds of contracts with private providers and agencies across the state that can provide these specialized services. So choosing a provider is similar to choosing a support coordinator. So you could go and interview them. Your support coordinator could go with you and help you interview. You can ask for recommendations, and your support coordinator can put out a request for services, which is called an RFS. And then you can interview companies and, see who responds and see who has availability to take you. Right now, it's getting hopefully a little bit better, but in the past, there's been a provider shortage. And so, we're looking at that from a legislative perspective to see how that can be remedied and how, providers can receive the wages that they need in order to provide services and not go out of business. It's just a huge picture that we need to look at, but your support coordinator can help you navigate that and say, okay, what's available, what services are required, who's going to be the best person to fit that. You can also research providers yourself. On DSPD's website, you can find a list of providers. The Utah Parent Center is going to, in a few weeks, release a database that shows, parent feedback on providers and how, what other people's experiences have been. And so that's an important tool for you as well. And we'll have that link on our website once that's available. It will be found on the DSPD page. But the provider handles all the paperwork for services. They communicate with that support coordinator. And so really they do that heavy lifting piece. And if you're having problems with your providers, you can work through those problems with your support coordinator to resolve any issues. And there is also a grievance process that you can go through so that you can, register those concerns if something is just not working out for you. And our booklet gives you more information on how to do that as well. So certain types of providers use a service model that incorporates group staffing. And some people get a little bit nervous about group staffing, but group homes and day programs are just two examples of people that provide group staffing. And support coordinators in DSPD will work with your team which is your person-centered support team, the people that meet together to create that plan and decide what level of staffing is needed for each hour that you're in the program. So let's break it down and give you an example here. So an example might be that somebody is living in a group home and is fairly independent. However, they do need a lot of help cooking a specialized meal each day due to health concerns. So this hour to prepare the meal might be staffed at 1-to-1, while all other hours at the house might be staffed at 1-to-3, since the person only needs basic supervision and assistance. So when your support coordinator or a provider talks about group staffing, that's kind of what they're referring to is let's look at your plan, let's see what the needs are, and then decide what type of care is needed. Another scenario might be more complicated, like due to maybe medical or behavioral needs. So this type of situation might require additional hours. So 1-to-1 or 1-to-2, and then other parts of the day, maybe 1-to-3. And there's pros and cons to all types of staffing. When you're advocating though, because we're really talking about advocacy today, again, looking at the needs of your loved one and determining what is going to be the best case scenario where they are given independence and autonomy, but also safety. Okay, so when you're coming off that waiting list and your DSPD transition coordinator tells you it's time to do the assessments, you really get into that person-centered support plan. And I want to jump ahead, because we've talked about this a lot already, to this video. And the DSPD transition coordinator or your support coordinator should educate you on how the meeting planning process works, how to include and how to schedule, how to include people and how to schedule your meeting, how to develop your plan and make sure it has all of the components that it needs. And this includes knowing how you can update your own plan. So you should be made aware of service options that you can make as far as making choices during the meeting. Like an example of that might be, where you should live. So I have this video for you that will talk about the basics here. There's a longer version of this. This version is only 2 minutes, but it really kind of breaks down all of the different components for you. And then later on in the presentation, I'll show you a video of a mom actually, her experience with her person-centered support plan. When you come off the wait list, your support coordinator or your SCE will meet you to update your person-centered support plan or PCSP that was set up by your DSPD transition coordinator. You should be leading your PCSP meeting. This is your support plan. Your PCSP is the basis for all of your waiver supports and services. The goals within your PCSP can be revisited at any time. Life changes can happen with illness, the loss of a job, or other life events. Please let your SCE know your needs so they can revise your goals and look for ways to support you. Individuals and their families are encouraged to be active participants in the PCSP process so they can maximize the potential to lead for a self-directed life. SCEs use the PCSP to coordinate and monitor services and supports for you. At a later date, if you hold a review meeting or are updating your PCSP, your SCE will review timesheets and talk to employees and providers to acquire information that will help you update your plan and revise your goals. The budget given to you by your DSPD transition coordinator will last for a 12-month period. However, remember that if your needs change, you can make an update to your PCSP at any time. Moving forward, the PCSP is generally reviewed 1 month before your budget ends each year. Service providers, such as group home staff or other support staff, use your PCSP to individualize supports, services, and strategies for you while you are receiving Medicaid waiver services. The plan should be based on your needs, not what is best for the provider. Remember, your PCSP is important. It is your map and shows your team how services are to be provided for you during the year. Okay, so I'm going to show you a few more tools, and Sarah will put all of these links in the chat for you. But these are tools that we've talked about a little bit with charting the life course, but also some new tools that you might not have seen before. So this first one is this workbook that will walk you through all the information you might need to know as you're preparing for your PCSP. It's Living the Life You Choose. And there's also some other like versions of this that will be coming out soon. So watch for that. We also have this Charting the Life course tool. So Maya goes in the middle of the star there, and then you can kind of break out and see every single area of life where Maya's needs are. And this will really help you as you're having the discussions in your person-centered support plan to really narrow down what Maya or Jackson's needs are. Because I know when you haven't done a lot of this pre-work before and you don't even know what's available, it might be overwhelming in the meeting to really be able to think about, okay, what does life look like here in this area? Or maybe they'll bring up an area of life that you haven't even thought about before with these different life domains. So it's important to do some pre-work before your meeting. Just like with an IEP meeting in school, you kind of think about what's gone well this year, where do you feel like your child needs more support? It's the same with the person-centered support planning meeting, to really do that pre-work before. This is another tool, the relationship mapping tool, where Jackson would be in the middle. And then, who are his friends? Who are maybe neighbors or family members? What about our church community? Who's in Jackson, in every area of Jackson's life? Who's his support system at his job at McDonald's? Who can help in these different areas that maybe it's like a vocational coach, a vocational rehabilitation coach. Add those people so that you can have a clear picture of options and those natural supports in life. This is another tool, the community integration document, and this resource provides guidance for support teams, advocates, and professionals to really engage and support people. The person responsible for leading discussions, conducting activities, and documenting plans are referred to as facilitators in this document. And this document includes the 5 different activities that can improve that community integration. Another tool for PCSP, this 5 competency domains. This document is for people who want to really learn about the 5 skill areas that these facilitators should have. And this is really good information for people who use person-centered planning for their families. And it will help them to know what to expect from their facilitator or the person helping them. And we can go into more detail because we only have an hour. I'm only able to give you a little snippet right here, but we can go into more detail on any of these domains. If you have questions, just reach out to us. When you're creating your PCSP, just please don't forget to include options for employment and education. There's just not one pathway, right, to getting a job. Some people might be able to just go out into the community and apply for a job and secure the right job for them, but other people might need more support. So work with your support coordinator, work with DSPD and vocational rehabilitation. There's a lot of tools. Sarah is going to add all of those to the chat for you. And again, we break all of this down in the yellow section of Transition University, so we can help you understand those options for you as well. I want to talk about your meeting and just kind of give you an overview. You are the one to attend your meeting, to help plan it, to invite people. You get to decide who's going to be there. The support coordinator should also be at your meeting, and they have specific duties to fulfill at that meeting. Your support coordinator should be monitoring your progress that you make and helping you to coordinate services from your providers. They should be helping to manage your budget and making sure that your health and safety are protected. And if you don't want your support coordinator at the meeting, you should discuss it with someone you trust and tell those reasons why, so that you can have a safe relationship and use your support coordinator as a trusted person. Your support coordinator will reach out to everybody that you have wanted at the meeting and the people on your team that you want to be involved. And you can create, what you want it to look like. Others who can participate in your PCSP or maybe your guardian or your parent, your caregiver, other family members, maybe your sister's really big and a huge part of your plan. Maybe you want your residential and day support providers there, therapists, teachers. Maybe you want your partner or your spouse there. This meeting should be held at a time that works for you. It's not just 2 o'clock on Thursday when it works for the support coordinator. It really should be a time that works for you and your team. So on your PCSP, it should be robust. Your services are built around the content of your PCSP. It should include the activities that you want to do in your life. And your support coordinator should keep notes about your goals and progress. And, she can ask you about those and you can share with her what's going well. Maybe you were really excited about one activity that you wanted in your PCSP once upon a time, and maybe your life's changed and maybe you need to switch it up. So communicate that to your support coordinator so that you can create a plan that works for you. So you're at the middle of this person-centered support plan. And when you help develop your support plan, you did it with people, and they should have asked you about things that you're good at. What about your needs for your living arrangements? Where you need to live and the way you want to live it, what you want your life to look like? Did your support coordinator listen to you? Did you share something and they really took note and paid attention of it? Did you have the choices in the support plan that you wanted to receive? What about the people who are going to provide those services to you? Do you have a choice in all of that? What about non-disability specific options? So when you have a job, are they only giving you options to work in a place where other people with disabilities work, or were you given options to work in other places? What about living arrangements? What about community activities? Are you able to access your community? And what about the support in life? Do you feel like you're getting the support that you need to live your life in the way that you want? This is a time where you need to be a self-advocate for yourself and really share your thoughts and feelings, because this is not something that's just, shoved at you. You really get to help create it. Because you are accustomed to living your life without the assistance of a waiver, like we've navigated 23 years of Jackson's life without the waiver, you might not be familiar with the way waiver supports can help to increase your quality of life and your independence. So when creating your PCSP with your team, consider all of the following areas. And these are all color coordinated with our Transition University materials as well. So there's advocacy and engagement. Are you given the opportunity to go vote? Do you understand the legislation? Do you want to get more involved and understand the legislation that's creating all of these rules and laws that govern these waivers and your ability to access them? What about community living? Where do you live? Were housing options provided to you? Are there community access options for you? What about transportation? Is there anything in your home that needs to be adapted? Do you need specific things that will help to keep your home more safe? What about daily life and employment? Was this addressed in your PCSP? What about your school? Did they include options for school? What about going out and volunteering in the community? Do you need help with communication? Do you need maybe assistive technology that can help you with life skills or to communicate with others? What about healthy living? Was your physical well-being addressed in your person-centered support plan? Do you need help preparing nutritious meals? Do you need help going to the gym? Do you need help with your personal safety? What about addressing your healthcare needs? Is all of that, has that been documented in your person-centered support plan? What about safety and staying safe and secure? What will happen in an emergency? What about guardianship? Do you need a guardian, or is a power of attorney sufficient? What about supported decision making? Has that been introduced to you? Are there people that can help you make decisions in your life? And the last one, let's see. I don't know if that's moving forward for you guys. I don't know if you're seeing that, Sarah. But social and spiritual. So it's important to build the friendships and relationships. That whole orange model of Transition University has recently been expanded so that you can have more resources for things like dating, understanding relationships. What about consent for sexual relationships? Do you understand what that means? What about sexual health? What about going out into the community and being able to meet people? These are all things depending upon your age and stage in life and what you want your life to look like. So make sure your person-centered support plan is addressing all of those different areas. Now, these are the Transition University tools that I've been talking about throughout the presentation. That youth work booklet is great for any age. It really breaks down each of those colored areas. And there's worksheets in there, pictures, the language is geared towards youth. But also the choices booklet is for parents, professionals, and for those who want a higher level of understanding of each of those areas. So Sarah will put all of that in the chat. There's an English version and also a Spanish version. On the Utah Parent Center website, we have a Transition University webpage, and you can go through and watch videos on each of these topics and be linked to additional resources as well. Now, there's just a couple of other things that we need to talk about. We have about 10 minutes left, but the documentation that's within the PCSP. In that settings rule video, we talked a little bit about restrictions and how those need to be documented. And Sarah will add all of these to the chat. But I worked with one family and they had guardianship of their loved one, and they were really confused about, well, I'm the guardian, but you're saying my loved one still has rights. And how am I supposed to keep them safe if I'm the guardian if they still have these rights? And so all of these frequently asked question sheets that Sarah's putting in the chat will kind of help you drill down on each of these to understand the settings rule, to understand restriction, to understand how something should be documented if there is an area of concern, because it is that balance. We want autonomy for our loved ones and empower them to make choices, but we also want to keep them safe. And sometimes a restriction is appropriate, but as much as possible, we want them to be able to live the life that they choose. So just to recap on a PCSP, these are the components that we've covered. So who's participating in the meeting? Did we make sure we address all of the areas for the quality of life? Does the plan really reflect all of Jackson's needs? Did we go through every area of life? Were we sure to talk about education? He's done with post-high, but does he want to take a class at our local Davis, what is that? They always change the name, the DTC, the technical school that's here in Davis County. Have we included that? What about vocational rehabilitation? Vocational rehabilitation can also help with that education piece. The two can be linked depending upon the assessments and the needs. What about restrictions? Is there an area that we need to really restrict? And if so, we really need to make sure that's documented so that Jackson's rights are being protected. Are we addressing all of this inclusion in the community? Are we getting him out and letting him experience life, letting him make choices, letting him fail in a safe way? Are we giving him the option to live the life that he chooses? Am I remembering as a caregiver or Jackson, if he's navigating his PCSP by himself, to use tools like charting the life course? Are we including those natural supports like Diane, his neighbor? Can she pick him up at work if transportation's not available? Who else is available in Jackson's circle of support? And go back and revisit your plan. You don't just have to revisit it every year. Revisit it as often as you want and tweak it as often as you want so that you can have the success and the power and the energy behind the person-centered support plan to really have it be an active tool that's really helping you live the life that you want. So we have just a few more minutes. This is about 3 minutes, but I think it's important. This is Colleen with her daughter Maya, and this is her experience of a person-centered support plan.
Hi, I'm Colleen, and I am the main caretaker and legal guardian for my 25-year-old daughter that is in DSPD services. We spend a lot of time trying to teach Maya how to make choices, as well as communicate those choices, and then translate those choices to other people who are part of her support team. With the help of Maya's DSPD support coordinator, we bring a team of people together that all care about her and want to work together and spend time with her to have the same goal and vision of a quality of life for her. We want her to be productive and happy. So we create a person-centered support plan for her. Maya's team can usually consist of her family, her friends, people who are working with her, like her supported living staff, day program staff, even just friends and neighbors that want to get to know her better. Every month we get together with her support coordinator. We go over what services we've been utilizing, which ones are working well for her, what doctor's appointments she's had, what medications she's taking. This helps us understand if we need new services or if we can hire new staff. The less work I have to do in a meeting is a really great green flag. That means everything's going well and all of her goals are being met. When the status quo is great, then she's happy and her quality of life is great. The hardest part for us is finding services that are available in our community. Sometimes it means that other providers don't have staff available, or the level of support that she needs isn't available in our community. Other times it's because we don't have budget enough. That would require us to go back and look for documentation, and look for ways that we can support our ask to DSPD for more services. I know that I can always go to our support coordinator and let her know when things change in our life, whether it's behaviors or a move or just things that are affecting her. I always want to update our support coordinator and make sure that she knows what's going on in Maya's life. For our family, our relationship with Maya's DSPD support coordinator has made the biggest difference in how we access and utilize our services. Knowing that she has our back and that she really knows the support needs of our family and of Maya has made our services more productive.
Okay, so quickly in our last 5 minutes, I just wanted to touch on guardianship. Just remember there's two types of guardianship. You don't have to have guardianship over all of the areas of life. And our transition specialist, Sarah, can help families understand how to get guardianship themselves if that's still something that you need to do so that you can continue to advocate for your loved one. There's also this balance that we want to talk about of dignity of risk. And I make mistakes every single day. I'm an accomplished older mom, and I have a lot of life experience, but I still make mistakes every day. And so I need to remember that that's how I've learned lessons, and it's okay for Jackson to be in situations where he might make a mistake. So it's this balance between duty of care or like making sure he's safe, but also that dignity of risk and having this great balance. So for instance, if Jackson were I gave this example yesterday in a class. If Jackson were at a day program and there was a 7-Eleven next door and we determined that that was, a safe opportunity for him to go next door, purchase a drink, and to come back to the day program, and he could do that without supervision, that's an opportunity for him to possibly make a mistake, but it's within a safe area that we've defined with his provider and his support coordinator. And so we need to remember to allow our youth and our loved ones to have that dignity of risk and be able to make mistakes within safe parameters, but also having high expectations of Jackson. He's not just limited. Yes, he has autism. Yes, he has a chromosome duplication. Yes, it's hard for him to articulate his wants and needs and do it in a calm way without a lot of excess behavior. But I can still have high expectations for him. I don't need to keep him in a box. And I can work with my support coordinator and those providers to help me expand my vision as a mom. I've controlled all of the things for all of the years as his mama bear and his advocate. But now it's time to have Jackson learn how to be an advocate for himself because I'm not always going to be here. And I need to let Jackson prepare and start to gain these tools. And I can do that as early as, 5 or 6, like letting my youth decide what they want to wear, what they're going to eat, and of course, if there was a disability, Prader Willi, where eating is a part of the safety issue, then of course that's going to be something I restrict. But as much as possible, I really want Jackson to have this autonomy in life and have high expectations for him. He's blown away our expectations at every level. Sure, it takes him longer to get there, but he can do it. And I know he can be successful. And using these tools, it's something that will help guide me and make sure that I'm not restricting him. The settings rule is going to help me let go a little bit and allow him to have the life that he wants. So we've talked about this a little bit. One of those fact sheets I gave you can help you understand the difference between guardianship and the settings rule and how the two can work together and how if there's a modification, it needs to be documented. But Sarah will add these other resources to the chat for you so that you can make sure and have all the tools that you need. And if you have concerns, because it's an emotional thing. These are our kids. We've raised them. We've given everything to make sure that they have the life that they want. And we don't want some new rule taking away something that keeps our kids safe. So let us help you understand it so that you can feel more comfortable with it and that you can continue to this work of advocacy for the ones you love. These are some other resources that the Utah Parent Center has available. So if you need help with advocacy or understanding one of these other areas, please reach out to us. We have not only Sarah as our transition consultant, but we have our Utah Family Voices project that really knows a lot about this area of support with waivers, things like SSI, how it works together. What do you do about things like room and board? How do we advocate and how do we make sure that we're representing our kids? So that is our presentation for today, and we are right to the hour. I'll stop sharing if anyone has to go because your lunch hour is up. I totally understand. But Sarah and I will stick around for a few more minutes if there were any questions in the chat or something maybe I didn't cover, or maybe something I said that might have been confusing that you need clarification on. Me.
There were not any questions in the chat that I could see. Aubrey says, thank you, Jenny.
Okay, you're welcome. And also, Sarah, I don't know if you caught it in the chat, but I put a link in there for the Disability Law Center's bill tracking sheet. There's a lot of bills right now that are dealing with the DSPD waitlist, voting rights, bringing people off of the waitlist into services. So do you know if that made it in the chat?
Sure did. Do you want me to read
Awesome.
there again, just to make sure?
I just look through there and make sure that it's in there.
Yep.
And, and if people didn't see it in the chat, just go to the Disability Law Center, click on their legislative link, and then scroll down and you'll see the bill tracking page. Even, it's not necessarily disability related. I know there's some concern that it might be, but the bathroom bill that's being talked about right now, there's a new version out. And we checked with the Disability Law Center yesterday, and we think that the disability portion is being represented well in the bill. But we will keep you posted on it. I know the Utah Parent Center just sent out something today. I think it's going out at noon on testifying about the wait list. So look at your email there, look at our social media, look at our Facebook page and see if you can see it. The UDDC also sent it out for those that need it. But this is a great week to put these advocacy skills to the test. Tonight from 4:30, I think, to 6-ish at the Capitol is the LCPD, the Legislative Coalition for People with Disabilities. They're having their reception there. So we'll be there with our Utah Parent Center Youth Advisory Board. Lots of exciting things happening. So if you want to be involved, just reach out and we'll help you learn how to get involved. Okay, no more questions. And thank you to our interpreter. I'm sorry, I'm a fast talker, so I bet your hands, you need to go put those in a hot water bath or something when we're done here. But thank you so much for being here. All right, everyone. Thank you, and we'll see you next time.